Hi, this is Dr. Petinato. I'm the founder of Cool Kid Dental, pediatric dentistry in Northport, Florida. And today I wanted to go ahead and talk with you about what is a lip tie and a tongue tie. So what a lip tie is, it's a tissue that everybody has. It connects from their upper lip to their gum tissue, but some people it's higher and more prominent than others and also thicker and can cause problems. We often see this when a child's in infancy, the child is unable to go ahead and latch on for breastfeeding, and so the child does not get a good seal. The child can either have problems eating and not be able to do it at all, or only gets a partial seal and ends up swallowing a lot of air and can cause colic. And basically it's all because of a lack of mobility, because this tissue is just too high and causing problems with that. So we get the children referred over to us by the pediatricians or lactation consultants as young as 1 or even 2 weeks old, and we bring them in, numb the tissue, remove it with a little laser, and then the tissue does not grow back and the child can immediately start breastfeeding again. It also causes problems in children who are older, even if they did not have problems when they were young with breastfeeding or if they were bottle fed. The tissue can be so high and so thick, it causes a couple problems. One is, again, lack of mobility. It can affect their smiling because they're not able to smile properly or move their lip enough. It can go ahead and cause hygiene problems. I had a child in here just last month who the tissue was so high that the kid was unable to clean around there adequately, so had some cavities on the teeth. So we got the tissue numb, removed it with our laser, and then went ahead and put some little fillings in there. And so we can fix it either before or after cavities, but better to fix them sooner. Another problem they can cause is they go ahead and cause orthodontic problems by giving a nice big gap in the front teeth there, which most people don't want. And no matter what you do, the tissue will stay there causing the gap. So if you don't want the gap, we again numb it, remove it with a laser, and then either teeth can close naturally, or sometimes we can put braces on in order to close the gap for you. Now for a tongue tie, same thing. It's just your tongue has a tissue that connects it to the floor of the mouth area, sometimes towards the gum tissue area. But what happens is the tissue attaches too far forward. For example, this baby right here, it's almost on the tip of their tongue. The child can barely stick their tongue out. This infant one's unable to go ahead and do any breastfeeding, again, because it cannot latch onto the nipple and get a good seal. Or if they are able to, the child will go ahead and have a partial seal, and again, swallowing air, causing colic. And that can also cause problems too when you get older. It can cause speech problems. The child is unable to go ahead and say certain sounds and causes issues with that. So speech therapists will send the children to us so we can go ahead and remove that for them. Again, we get it numb, take a little laser to it, the tissue is gone, does not grow back, and then they have free use of their tongue again. If you think your child has these problems, feel free to give us a call either at coolkiddental.com or our phone number at 941-841-1010, and we can help you. Thank you very much. And our next video will be the frenectomy, the surgical procedure we actually do to correct and remove the tissues. And little baby Yoda saying goodbye.